आपका दोस्त और आज के इस 90th नॉन स्टॉप सेशन का होस्ट, सभी देखने सुनने वाले और RWAs का, NGOs का, मार्केट एसोसिएशन का, विशेष रूप से टेक्सटाइल एसोसिएशन का, अपने सभी HCFI के मेंबर्स का और अपनी हेल्थ एजुकेटर एक्सटेंडेड फैमिली का आज के इस नॉन स्टॉप 90th सेशन में स्वागत करता हूं। आज का सेशन भी 2 भागों में रहेगा। प्रथम भाग में डॉक्टर कालरा कोविड अपडेट देंगे और द्वितीय भाग में आज के स्पेशल स्पीकर जो हैं, विशेष इनवाइटी जो हैं, मिनाल शाह, घुटनों के बारे में, नीज के देखभाल के बारे में बताएंगे। उससे पहले कि आज का सेशन आरंभ करें, मैं आप सभी को आज के इस 73वें भारतीय गणतंत्र दिवस की शुभकामनाएं देता हूं। हम भारतीय हैं, हमें भारतीय होने पर गर्व है और आपके विशेष परमिशन के साथ मैं आज 2 शब्द इस कविता के माध्यम से इस कार्यक्रम के, इस सेशन के आरंभ होने से पहले कहना चाहूंगा। हम अपनी माँ भारती का धन्यवाद करते हैं और उस भारत भू की धूल का अपने मस्तक पर लगाते हैं। आइए, अगर आप अपने मन में मेरे साथ गुनगुना सकें तो मैं आपका आभारी रहूंगा। ये गीत है, आप मेरे पीछे गा भी सकते हैं। धन्य धन्य है, धन्य धन्य है भारत भू की धूल, यह भारत भू की धूल। धन्य धन्य है, धन्य धन्य है भारत भू की धूल, यह भारत भू की धूल। इसी धूल में खेल खेल कर हुए थे वीर महान, इसी धूल में खेल खेल कर हुए थे वीर महान, इसी धूल में खेल बने थे राम कृष्ण भगवान, इसी धूल में खेल बने थे राम कृष्ण भगवान। मल मल कर मस्तक पर इसको, मल मल कर मस्तक पर इसको पाया रूप अनूप, यह भारत भू की धूल, यह भारत भू की धूल। स्वर्ग में रहने वाले इसमें खेलन को ललचाते, स्वर्ग में रहने वाले इसमें खेलन को ललचाते, 3 लोक में इसकी महिमा के गुण गाए जाते, 3 लोक में इसकी महिमा के गुण गाए जाते। पाकर इसको स्वर्ग लोक के, पाकर इसको स्वर्ग लोक के सब सुख जाते भूल, यह भारत भू की धूल। धन्य धन्य है, धन्य धन्य है भारत भू की धूल, यह भारत भू की धूल। एक एक कण इस धूली का है अपने को प्यारा, एक एक कण इस धूली का है अपने को प्यारा, एक एक कण इस धरती का है नैनों का तारा, एक एक कण इस धरती का है नैनों का तारा। मिट जाएं ये और जिए हम, मिट जाए ये और जिए हम, यह ना होगी भूल, यह भारत भू की धूल, यह भारत भू की धूल। मिलजुल कर नित शाम सवेरे हम इसके गुण गाते, मिलजुल कर नित शाम सवेरे हम इसके गुण गाते, और प्रेम के अमर सूत्र में, और प्रेम के अमर सूत्र में हैं हम बंधते जाते, इसी धूलि में हमें हमारे सब दुख जाते भूल। इसी धूल में हमें हमारे सब दुख जाते भूल। यह भारत भू की दूर। धन्य धन्य है, धन्य धन्य है भारत भू की दूर। यह भारत भू की दूर। एक बार फिर गणतंत्र दिवस की, रिपब्लिक डे की आप सबको शुभकामनाएं। धन्यवाद। ओवर टू यू डॉक्टर कालरा।
धन्यवाद चावला जी। बिल्कुल आपने ठीक कहा कि हम सबको अपने भारतीय होने का गर्व आज होना चाहिए। आप सब उपस्थित सज्जनों को रिपब्लिक डे की, गणतंत्र दिवस की हार्दिक शुभकामनाएं। तो आज देखें, अगर मैं स्क्रीन शेयर करूंगा। ये पूरे विश्व में एज पर WHO के जो 6 रीजन हैं, इस हफ्ते एंडिंग 25 ऑफ जनवरी टोटल जो है 5% न्यू केसेस इंक्रीज हुए हैं कंपेयर टू इसके पीछे वाले हफ्ते। और डेथ्स देखें तो सिर्फ 1% इंक्रीज हुआ है। पिछले हफ्ते 6 में से 5 रीजन में इंक्रीज इन केसेस थे, और इस हफ्ते देखें तो कंपेयर टू प्रायर वीक केसेस की बढ़ोतरी में थोड़ा सा चक लगा है। देखें तो यूरोप में 13% इंक्रीज हुए हैं नए केसेस, और उधर से डेथ 5% कम हुई है। अमेरिका में भी जो काफी दिनों से काफी ज्यादा केसेस रिपोर्ट कर रहा था, वहां भी जो है इस हफ्ते पिछले हफ्ते के मुकाबले 10% की कमी आई है, पर उस प्रपोर्शन से डेथ कम नहीं हुई, 7% है अभी। साउथ ईस्ट एशिया सबसे ज्यादा जो केस रिपोर्ट हुए हैं इस हफ्ते में, जिसमें कि भारत और उसके आसपास के देश, वो जो है साउथ ईस्ट एशिया से 36% इंक्रीज इन केसेस और 44% डेथ भी बढ़ोतरी हुई है इस हफ्ते। और वेस्टर्न पैसिफिक से सिर्फ 1%, और साउथ ईस्ट एशिया के अलावा ईस्टर्न मेडिटेरियन कंट्रीज में भी 39% लगभग जो है इंक्रीज केसेस इस हफ्ते रिपोर्ट हुए हैं, और डेथ भी 15% वहां पर भी ज्यादा हुई है। अफ्रीका, जहां से कि ओमिक्रॉन ये आया, वहां पर देखे इस हफ्ते 31% जो है केसेस की कमी आई है, और ऐसे ही 14% में डेथ भी कम हुई है। तो ओवरऑल पूरे विश्व में इस हफ्ता 5% केसेस की बढ़ोतरी देखने को मिली, और 1% बढ़ोतरी डेथ रेट में हुई। इंडिया में देखें हम तो लास्ट 24 आवर्स में अब ये 3 लाख से केसेस, न्यू केसेस कम होके 2 लाख लगभग 85,914 केसेस रिपोर्ट हुए हैं, और डेथ जो है 665 24 आवर्स में हुई है। टोटल वैक्सीनेशन देखें तो 163 से ज्यादा करोड़ से ज्यादा इस टाइम जो है वैक्सीन की डोजेस लोगों को लग चुकी है, जो कि एलिजिबल है एज पर गाइडलाइंस ऑफ गवर्नमेंट ऑफ इंडिया। एक्टिव केसेस अभी भी 5.55% है जितने भी केस हैं कोविड के, उनमें से एक्टिव केस वो है 5.55%, यानी कि 22,23,018 केस पूरे भारतवर्ष में। ये जितने भी इंडिया में केसेस रिपोर्ट हुए हैं ऑल ओवर द वर्ल्ड, इस टाइम ये जो है ओमिक्रॉन जो है ये पूरे वर्ल्ड में छाया हुआ है। डेल्टा को इसने रिप्लेस कर दिया है। और देखें ऑल ओवर द वर्ल्ड 89.1% केसेस जो हैं जिनका कि जेनेटिक सीक्वेंस पूरे वर्ल्ड में जो हो रहा है उनका जो देखें 89.1% जो है ओमिक्रॉन की वजह से ये नए कोविड के इन्फेक्शन चल रहे हैं। डेल्टा जो है अब सिर्फ जो है लगभग 10.7%, बाकी जो है लेस देन 0.0% वो अल्फा बीटा गामा वो चल रहे हैं। तो मेजॉरिटी जो है इस टाइम देखें पूरे वर्ल्ड में ये ओमिक्रॉन का संक्रमण जो है सारा फैला हुआ है। हमारे देश में स्टेट्स में देखें इस टाइम जो केरला और कर्नाटका और महाराष्ट्र में भी कम होने शुरू हो गए हैं। मैं ग्राफ दिखाना चाहूंगा बजाय कि नंबर्स के। ये देखें कर्नाटका में जो है 24 तारीख को भी 45,266 केस रिपोर्ट हुए थे और लास्ट 24 आवर्स में भी 41,400 के करीब केस हैं। केरला में 24 तारीख को लगभग नए केस 26,514 थे और आज देखिए 55,000। तो सबसे ज्यादा इस टाइम हमारे भारतवर्ष में ये केरला से ही केस नए रिपोर्ट हो रहे हैं। हो सकता है कि यहाँ पर वैक्सीनेशन तो इतना अभी आज की स्थिति ठीक ठाक है, मे बी केरला में जो है डेल्टा पहले काफी लंबा चल रहा है, अभी इसकी डेल्टा वाली सेकेंड वेव भी खत्म नहीं हुई थी, शायद वहां पर ये डेल्टा और ओमिक्रॉन दोनों चल रहे हैं, इसलिए जो है केरला में ये बहुत ज्यादा केसेस रिपोर्ट हो रहे हैं और डेथ भी जो है कंपेयर टू अदर स्टेट्स ज्यादा हो रही है। गुजरात में देखें तो 24 तारीख को 13,805 केस थे और अब जो है लास्ट 24 आवर्स में 16,608 केस रिपोर्ट हुए हैं। इस मीन्स अभी वहां पर डिक्लाइन शुरू नहीं हुआ है। ऐसे ही जम्मू कश्मीर में देखें जहां पिछले महीने अराउंड 100 केसेस चल रहे थे, 24 तारीख को 5,394 और आज जो है जम्मू कश्मीर में 6,570 और 14 मृत्यु हुई है। तो इस टाइम ये जो स्टेट्स हैं कर्नाटका, केरला, जम्मू एंड कश्मीर, गुजरात, ये थोड़ा सा महाराष्ट्र भी, उत्तर प्रदेश हालांकि इलेक्शन गोइंग स्टेट है पर इसमें 3-4 दिनों से थोड़ा सा डिक्लाइन ट्रेंड चल रहा है, अच्छी बात है। महाराष्ट्र में भी जो है अब फिर दोबारा से लास्ट 24 आवर्स में केसेस 33,914 रिपोर्ट हुए हैं। तो अभी महाराष्ट्र में अभी हमें और ऑब्जर्व करना पड़ेगा कि डिक्लाइन शुरू हुआ है या अभी फ्लक्चुएशन चल रही है। दिल्ली में देखें तो डेफिनेटली लास्ट एक हफ्ते से अब समय या एक हफ्ता 8-10 दिन से डेफिनेटली ट्रेंड जो है डाउनवर्ड शुरू हो चुका है। दिल्ली में लास्ट 24 आवर्स में सिर्फ 6028 केस रिपोर्ट हुए हैं। हॉस्पिटल बेड देखे थ्रू आउट आवर कंट्री 85.8% बेड्स तो अभी खाली पड़े हैं। जो थर्ड वेव का अनुमान लगा के जो बेड की संख्या बढ़ाई गई थी, तो सेकेंड वेव के मुकाबले अब हम देखें तो उतनी घबराने की स्थिति नहीं है। वी आर क्वाइट कंफर्टेबल। और अभी भी लगभग अर्बन एरियाज मेट्रो में से तो केसेस कम होने शुरू हो गए हैं। अब जो बचे हुए हैं, अब जो हमें आगे कुछ दिनों में देखना है वो है रूरल एरियाज। अब ये देखिए, इंटायरली अर्बन एरिया से तो डिक्लाइन शुरू हो गया, बाकी जो है इंटायरली रूरल एरियाज, लार्जली रूरल और मिक्स्ड, वहां पर अभी कुछ केसेस में बढ़ोतरी कुछ और दिन जो है देखने को मिलेगी। क्योंकि अब जो है मेट्रो सिटी से ये गांवों की तरफ केसेस ज्यादा अब जा रहे हैं। शुरू में हम थर्ड वेव में देखा बेसिकली सिर्फ अर्बन मेट्रोज में ही था, रूरल एरिया में केसेस बहुत ज्यादा नहीं थे। पर अब जो है देखने को मिल रहा है कि रूरल एरियाज में, मिक्स पॉपुलेशन एरियाज में जो है केसेस अब थोड़ा सा बढ़ रहे हैं, विच इज ए नेचुरल फिनोमिना। तो हमें ये जो दो चीजें हैं, कोविड एप्रोप्रिएट बिहेवियर और वैक्सीनेशन, अभी भी जो है जैसे महाराष्ट्र में पिछले दिनों से काफी डिक्लाइनिंग ट्रेंड था, फिर बढ़ना शुरू हुआ, तो सावधानी की जो है अति आवश्यकता है। अभी भी जो है 5 स्टेट्स में अब इलेक्शंस होने जा रहे हैं। हालांकि मास रैलीज वगैरह सब अभी बंद है एज पर इलेक्शन कमीशन नोटिस। और फिर भी हम देखते हैं कि पद यात्रा में या जो भी है काफी भीड़ भाड़ देखी जा रही है। तो हमें सावधानियों की अति आवश्यकता है ताकि ये जो वेव है और फिर दोबारा से आगे ना बढ़े। ओवर टू चावला जी।
थैंक यू डॉक्टर कालरा। आज के इस सेशन को आगे बढ़ाते हैं और मैं रिक्वेस्ट करता हूं मिनाल शाह से आज का सेशन शुरू करने के लिए। आज का उनका टॉपिक रहेगा हाउ टू टेक केयर ऑफ योर नीज, टिप्स एंड ट्रिक्स। आज सभी इस बीमारी से ग्रसित हैं, सबको तकलीफें हैं और सब चाहते थे कि इस विषय पर थोड़ी चर्चा की जाए और क्या क्या एक्सरसाइजेज हम घर में कर सकते हैं और क्या क्या एक्सरसाइजेज हमें करनी चाहिए। उस बात को ध्यान में रखते हुए हमने मिनाल को आज इनवाइट किया है। मिनाल इज ए नोन फिगर, शी इज द मेंबर ऑफ आवर एक्सटेंडेड हेल्थ एजुकेटर फैमिली। तो उस ज्यादा समय न लेता हुआ मैं दोनों आपको उनके सामने उन्हें आज आपको अपने बात रखने के लिए आमंत्रित करता हूँ। ओवर टू यू मिनाल, वेलकम।
Thank you so much, Chawla ji. Thank you, Kalra sir. First of all, happy Republic Day to everybody. Thank you for having me here today. It has always been an honor to be a part of this family and have this platform to talk to everybody and take forward Dr. KK's vision of educating everybody as much as possible. Today, I want to talk about a very common problem all of us face is dealing with painful knees, dealing with knee problems, or dealing with knee instability. The agenda for today's meeting will be to help everybody understand कि knee problems होते कैसे हैं. सबको हो तो जाते हैं, but what causes them? What is the root cause for them? Because in my practice, I feel like if you can get to the root cause of something, you can most definitely cure it. So I will take you through a presentation, and at the end of the session, we will have 10 to 12 minutes for everybody to drop in their questions. अगर आपको बीच में भी कोई भी questions रहेंगे तो please आप chat box में डाल दीजिएगा, and after the session ends, we will attend all of them one by one. Is my screen visible to everybody? Okay. Perfect. So how to preserve your knees and take care of them. The agenda is, first I will talk to you कि knee कैसे दिखती है, उसकी anatomy कैसे है. Some facts about knee pain, what causes knee pain, and the most common condition, osteoarthritis, क्या होता है, कैसे होता है, उसमें क्या क्या changes आते हैं, and how you can detect it at the right time and take the appropriate help that you need. After that, we will talk about other treatment options for knee pain. What to do for knee first aid if you have a sudden fall, a sudden injury, a sudden fracture, what to do. Then obviously I will get to the tips of maintaining healthy knees, and when should you seek professional help, when should you understand that this is your time to stop, and this is when you go to a professional medical personnel and get your knees checked out. So let's get started. Before I start, I want to give a disclaimer that this is purely for educational purpose and should not be used for diagnosis or replace any medical professional advice. Keeping this in mind, let us move on. So this is what your knee looks like under your skin. This is your patella. Wait, I'll just start my laser so everybody can pay attention. Okay. So this is the patella, the tibia, and the femur. These three are the most important bones that form the knee joint, which is your kneecap, your thigh bone, and your shin bone. In common language, these are all your muscles that you see which traverse around the knee. और ये आपके सारे ligaments जो हम बोलते हैं ना, ACL फट गया, ligament टूट गया. This is the small ligament that keeps everybody on our knees and on our toes. And then you have these bed-like, small pillow-like structures called menisci, which are the shock absorbers of your knee. So every time you put your foot on the ground, this is what absorbs shock along with your foot in your knee. So now that we have a general idea of what the knee looks like, let's understand what is knee pain. So about 80% of people will experience knee pain in their life. I'm sure everybody sitting in the audience has felt what a knee pain feels like at any given time in their life. It is usually a byproduct of poor hip and ankle biomechanics. I will explain what is biomechanics further, but in a nutshell, knees यहाँ है तो उसके ऊपर और नीचे वाले जो structures है, the stability and the mobility of them determines how healthy your knees will be. So knee issues are rarely ever related to knee unless it's a direct trauma or a direct fall to the knee. Excessive wear and tear until a critical point is reached and knee is symptomatic, and pain can form or pain can come or present itself in different ways. Some people can feel tightness, some people can feel soreness, tingling, burning, numbness. It is different for everyone. And if you ever find yourself in a position कि आपको सुबह stiffness हो रही है, and over the day, throughout the day, when you move your joints, when you walk around, you're feeling better. Morning stiffness is a sign of early arthritis and it will require immediate attention. We will talk more about arthritis in the further slides. Now, location of the pain. This is a basic map. You can take a screenshot of this, which can sort of guide you towards what is causing your pain. Usually the front of the knee, which is some of the most common pain that people have, it is because of weak muscles, which is your weak thigh muscles, and because of kneecap issues. It can also be because you are not sitting properly, you're not walking properly, you have terrible footwear. There are a lot of reasons why knee pain can occur, but these are basic reasons why area-wise you can differentiate what pain is showing up where. Now, what are the common knee symptoms? Obviously, you will see pain. Some people hear a popping sound in their knee when they twist their leg. That's when you know the ligament is injured. You will also hear crunching. You will hear a locking. Some people feel that after a certain range of motion, the knee cannot go up or cannot go fully down. You will feel instability. You will feel like if you're standing on your knee, you need some support to hold on to. And you will also see swelling. When you see all these symptoms, it is a warning sign. Your body is trying to tell you that I need attention. Something is wrong inside. Please seek help. Now, what causes knee pain? The number one cause of knee pain worldwide is wear and tear. Now, we do not have a solution for aging. We do not have a solution for our daily activities. But what we do have in our hands is how we maintain the knee and how we keep it healthy, which is what I want to guide you towards today. Poor biomechanics and posture. If you are walking in a funny way, if you're walking with hip pain, if you're walking with improper footwear, if your posture is not right, you will experience knee pain at some point in your life. Poor gait biomechanics, again, the way you walk. Then there is trauma, a fall, road traffic accident, you slipped somewhere, it could be anything. Osteoarthritis.
Hello.
Talk about that further. Inactivity. As funny as it sounds, the more inactive you keep your knee, the more it'll hurt. I will explain why in the further slides. Surgery also causes knee pain. Even after a knee replacement or a partial knee replacement, you will have some amount of knee pain which will need attention. Just because you get surgery does not mean it will magically disappear. Exposure to a new unacclimatized activity. Now in January, I don't know because of COVID what is the situation, but a lot of people are very motivated that, okay, I'll go to the gym today. And on the first day, they run 5 kilometers on the treadmill. While you have not done that in the last 11 months, and you wake up one day and choose to put your knee through that pressure and through trauma, the knee is going to answer back and say that I will not work and show up with pain. Articular pathologies, which includes your ligament sprain, your synovial fluid membrane tear, your meniscal tear. There are a lot of conditions which can happen inside the knee because of trauma or pathology of the connective tissue. Congenital or developmental conditions like Osgood's Clatter disease and certain other diseases which you see in adolescent children or babies can cause knee pain in the future. Sometimes even flat feet can cause knee pain when the child gets older. Now, the burning question is, why do some people experience knee pain and some don't? The answer to that is, it is all in the biomechanics. Biomechanics is the study of the human motion. So it is ruled by your basic physics of motion, force, momentum, levers, and balance. And when your body moves, when anybody moves in space, it is governed by acceleration and speed. Similarly, when your body goes through cycles of different force couples on it. We'll explain how it works in the next slide. So how are we ending up with faulty knee mechanics? It is all in your foundation and in your feet. Now, here you can see what the feet looks like on the inside, the bones. And this is your calcaneus, talus, and tibia. These are the building blocks or the foundation of your walking pattern, of your entire body structure, as well as the shock absorbing forces that you will experience when you walk. Now, this is what the foot looks like from behind. You have the normal foot, which is in between. On the left, you have the pronated foot, which is like your flat foot, and supinated foot, where your arches are very exaggerated. So your foot is either aligned or not. But when it is not aligned, this is what happens. So when your foot is aligned, as we can see on the right side, you can see that the posture is corrected. The knees are at level, the ankles are at level, the knees are at level, the hip is at level, and eventually even the shoulders are at level. Now here you can see there is a slight curve in their foundation. Now because of the curve in the foundation, the knees also have to bend in this direction. The hips also have to turn to accommodate the knees, and eventually your back will have to accommodate the hips and your neck will go for a toss. So I want you to understand that just because your foot is not aligned, the whole body will go for a toss, including your neck. And bad foot mechanics has also been shown to cause headaches. Now, again, reinforcing what we said, dynamic displacement of the ankle on the heel bone creates a mechanical disadvantage. So your knee has to do more work, your hip has to do more work, eventually tiring you out and working your muscles way more than needed. This is again what your foot looks like when you have a normal foot, high arch, or a flat foot. Now we walk about 5,000 to 7,000 steps a day, and every step you take in an abnormal position, it is a new wear and tear for your knee joint and your structures, because like we saw, the forces go from ground up. So every wrong force on the ankle will go all the way up to the knee. Now, osteoarthritis, it is a degenerative condition of the knees. Females are more affected than males because of menopause. And age group, you will see it is mostly seen in people who are past the age of 45. Trauma can predispose osteoarthritis. Obesity is one of the major causes of osteoarthritis because of the amount of force that is on knees. Genetics can predispose osteoarthritis in a good amount of cases. Malalignment, again, what we saw with the foot, can cause excessive wear and tear in the wrong direction, which can cause osteoarthritis, which are again pathological forces. Like we saw, the biomechanical forces, they are destroying our joints because of age, time, and gravity. As we age, the amount of wear and tear increases. Again, with time, the amount of wear and tear increases. And we always have gravity pulling us down and gravity acting on our body. So our body has to put in that amount of force to lift itself up from the ground. So it is a war against time, age, and gravity. And if you don't treat osteoarthritis, it can cause deformities which look like this. Now, when you see an arthritic joint over here on the left, you can see that the bone is exposed. You can see bony spurs over here. You can see that the meniscus, the cushion of the knee, is eroding, which is why this bone rubs off on this, which causes pain. As you can see, this is a healthy joint, and on your right is a joint with osteoarthritis. You can see the damage caused in between the two bones. Now, this is what it looks like on an X-ray. These are 4 grades of arthritis. Ideally, at the first and the second grade, you can manage it non-surgically. The third grade would need some walking aids or some modification. And at the 4th grade, a surgery is usually suggested. So in the first image, you can see that the joint spaces have not narrowed that much. There is still space between the two bones. In the second picture, you can see that there is a slight, can you see the slight hook-like thing, which is a spur formed at the edge of the bone, and there is erosion of the bone. You can see this is a straight line and this is a curving line. Then the joint spaces have reduced. In the 3rd grade, the joint spaces have further reduced, and in the 4th grade, they've almost touched or touching each other and grinding on each other. This gives an immense amount of pain and it requires replacement. Now, this is what happens if you do not treat it. You can have bow legs, where your legs look like 2 bows. You can have knock knees, where the knees are touching each other. So, obesity and osteoarthritis are a vicious cycle. So when you have obesity, your exercise and locomotion increases the load on the knee joint. When you have an increased load on the knee joint, the repetitive high magnitude loading will cause knee osteoarthritis. But when you have knee osteoarthritis, you will have pain and discomfort. When you have pain and discomfort, आपको लगेगा कि मुझे नहीं करना है कुछ, I just want to sit, do nothing, give my knees rest. But when you rest that much, you will again inhibit weight loss and cause obesity. So it's a vicious cycle where somewhere someone needs to come in and stop at pain and discomfort and loss of function and mobility. Now that can be done in all of these ways. The first way is pharmacotherapy, which is your medication, which your GP will be able to guide you best according to what's best for you given your health condition. I will talk about all the other options as a physiotherapist. The first one is appropriate footwear. Then we have physiotherapy. Then we have offloading devices, hydrotherapy, weight loss, very important. After that, if none of these things work, you can move on to slightly invasive options like intra-articular injections, where we can give plasma in your knee joint, we can give corticosteroids in your knee joint. Depends on what is your need and what fits your body the best. We can give nerve blocks so that you don't feel the pain. We can have partial or total knee replacement. Let's talk about these options a little more in detail. Now, footwear, very, very interesting topic. Now, this is what majority of our feet look like, 5 fingers next to each other, wide foot. But this is what majority of the footwear in the market looks like. Now, how is this appropriate? You tell me, how is your foot, which fits like this, supposed to fit in the shoe? So when choosing the right shoe, you will have to make sure that your foot is able to fit inside the shoe and not poking through the sides. Like, can you see here? Can you see how tight this is? Can you see how her foot is trying to poke through the shoe? Whereas here, the person is able to keep all his fingers properly, all his toes properly, and have a balanced pressure throughout the foot. When you have balanced pressure under your foot, you can make sure the forces to the knee are not excessive or pathological. So footwear, very, very important, cannot be missed. These are some examples of what your footwear should look like. Your feet should be able to splay. Splay means they should have space to wiggle. They should have half an inch, above themselves. Can you see there is some space above her footwear? You can see she has a bunion here, but she's still able to keep all her footwear in place. This is what a natural, non-pathological foot looks like. All of its muscles are functional. It is sending forces up the body in the right way and the right direction. But this was possible because this foot was not kept in a footwear that looked like this. This is not natural for your foot to be in. Now, physiotherapy management. We have a lot of options for physiotherapy. First is patient education. Patient education is an underdog, but if done right and if done appropriately, just by making the patient more aware of their condition, you can see how quickly they heal out of it, because they have a sense of control over their condition, because they have more information on it, because they understand the situation better. We have pain management techniques, which we will talk about further. Low impact exercises like walking, swimming. Swimming is your best friend when you have osteoarthritis. When you are in water, the forces of the water, the buoyancy helps you in feeling weightless, and you can move your joints without any pain or any discomfort or any wrong forces being pushed on them. Then you have stretching, very important. Strength training. This is probably one of the most underutilized departments, I would say, of physiotherapy, because when you strength train your muscles, they sort of pull your bones in a way and put in forces in a way that your bones stay in place and you don't have wrong forces coming up your knee. Postural correction, very important. Ergonomic and biomechanical corrections via tweaks or devices. We'll talk about that further. Now, what are braces and devices? So these braces, when you place them, can you see this is almost a grade 3 and a 4 osteoarthritic knee? You can see this is almost touching over here. When you place this brace over here, this takes the weight of the knee from this area and translates some of the weight here. So when this happens, there is no grinding of these two bones and you can walk pain-free. This is a basic explanation of how the forces work, how the forces move your thigh bone, how the forces move your shin bone to make sure your knee is in proper alignment. Now, these braces are strictly prescription only. Any other use of braces is not advised whatsoever. A lot of times we have the habit of taking a brace like this, like the gray one which I have shown here, कि लोग बस ले लेते हैं मेडिकल से कि उन्होंने बोला है अच्छा रहेगा. What happens is when you have an unattended use of braces, the muscles around the knee decide to give up. जैसे कि हमें बाहर से support मिल रहा है, so why should I work on keeping the knee in place? Why should I work on exerting forces to keep the knee in its proper position? When you use braces for a time period of longer than 6 weeks, the muscles start deteriorating in that area. So do not use unprescribed braces or walking aids because you will be causing more damage than any benefit. The first is braces and device, then we move on to walking aids. Now, when you use a walking aid, 20% of the pressure on the knee joint is relieved, which is a huge amount when you have knee issues, when you have osteoarthritis, when you have problems with knee pain. One thing you need to understand is the reason we use walking aids is so that our base of support increases. Earlier, the person could walk only on this much base of support, but now he can walk on this whole area because he has the assistance of a cane. Same thing with the cane. Use it only if you are prescribed it, and do not ignore it if you are prescribed it. A lot of people feel shameful or feel scared or feel that people will judge them if they use a cane or a walker. But trust me, you are doing yourself a favor if you are prescribed this and you're using it. Your knees will thank you in the long run. Now we have hydrotherapy, which is the up and coming field of physiotherapy and one of the most lucrative fields and the easiest to adapt. Here we use the principle of buoyancy, where we make sure the weight on the knees is taken off and you will be taken through multiple walking exercises. You have an underwater treadmill. You will be given some amount of weight training as well when you are underwater. The benefit here is your knees will do the work without feeling the pain or the stress of the weight of your entire body. Then we have, one second, getting this. Yeah. Then we have exercise therapy. Now, this is a general picture of what knee exercises look like. Every person will have their own specific prescription. Do not take your friend's knee pain prescription and try to do it yourself. Every person will be seen by a qualified physiotherapist on a case-to-case basis because every knee pain is different. Your activity level and your friend's activity levels are different. But exercise therapy has shown promising results enough that people have decided to cancel their surgeries in the future. Now, knee first aid. What to do if you have a sudden knee injury, if you have a sudden fall, if you don't know what to do. So when you fall or hurt your knee, this is what they will look like. The knee on the left is after a knee replacement surgery because you can see the scar and they've had a swelling, and this is what a knee contusion looks like, where you see there is some amount of hemorrhage over here and over here. This could be caused by basic trauma or fall on the knee, very common with children. Now, when you see a swelling this size, immediately your first response should be keep the area above the level of the heart. It helps the swelling to reduce and all those fluids to run back through your lymphatics and out of your system. If you hear a popping sound with a twist injury, remember this. If you are walking, if you twist your leg and you hear a pop, it is most definitely a ligament tear or a ligament injury. Immediately call your doctor, ice the area. In case of fractures, you will see a huge swelling with browning or purpling of the area. Don't try to do anything at home. Please visit an emergency department ASAP so that you don't cause further damage. Because a lot of times when you fracture your knee, there are tiny fragments inside the knee which can hurt your artery or your nerve in the area, causing you to lose sensation or even your limb. So if you see a fracture, if you're unsure of what is happening, immediately go to a doctor. Now remember the rule of thumb. Ice you will use for acute injuries immediately after a fall. Somebody fell down, you don't know what to do, and you can see that there is swelling, there is redness, the area feels warm. Compare it with the other knee. Is the knee which got injured warmer than the other knee? Then use ice. Now, heat you will use for chronic injuries. For somebody who has had a fall 6 months ago, for somebody who has had signs of osteoarthritis for 4 to 5 months. Those are the only cases where you will use heat. Otherwise, for immediate action, ice is your best friend. Now, you can take a screenshot of this, very important. This is all the 12 things you need to maintain your knees for the rest of your life. First, very important, but easily forgotten, always stand on both feet. Now, we have the habit of doing this and this with our legs when we're standing somewhere, when we're talking, when we're bored. Sometimes it's okay, but in the long run, you're putting stress on one for a long period of time and easing off the other one. You don't want that. You want to distribute the weight and stress of your body evenly. Second is strength training, especially the front of the thigh. Why do I say the front of the thigh? Is because it holds your patella and your femur in place. All the muscles in the front of the thigh hold all of your knee bones in place, the ligaments and the ligaments of the hip, and also gives you force to walk and propel your body forwards. Now, improve your hip and ankle biomechanics. Like I said, if you have bad hips or bad ankles, you are sure to have knee issues. So, what I need you to do is sit properly. Where you place your hips on the chair, they should be well supported. I have further slides to show you how to do it. Ankle biomechanics. If you feel like you have a flat foot, if you feel like you have a high foot, get it assessed by a physiotherapist. Talk to them, ask them what are the best options for your condition. Fourth, appropriate shoes. Like I said, very important. It is the foundation. It is where you're going to place your foot 5,000 to 7,000 times a day. You want to invest in good shoes. Never cheap out on bad shoes because it is going to cost you your knees in the long run. Maintain proper weight, again, for the forces being put on the knee. For every 5 kilos that you lose, there is around 10 to 15% of weight which is going off the knees. So keep that in mind. But again, don't do activities which you have never done just to lose weight. You will be causing more damage. Then you have calf and hamstring stretches. Now, these are very underutilized. Your calf and your hamstrings also help propel your body forwards when you're walking. So if you improve your hip and ankle mobility and its flexibility, your knee will never undergo stiffness. Now, take frequent breaks every 20 minutes if you sit for long hours. People may think that when you're sitting, your knees are at rest. Kuch nahi hota hai. No. First slide, remember where I said inactivity will also give you bad knees. So every 20 minutes, you could take a round around the room, take your calls on the phone and take a small walk. Any low impact knee mobility, please do it at least twice in an hour. Very, very important. Now, eighth, very easily forgotten, wear a seat belt. Now, why do I say seat belt when you're driving? Every time you hit the brake suddenly or you have a road traffic accident, one of the most common injuries we see are knee injuries because the knee hits the dashboard at a very fast pace. However, if you have worn your seatbelt properly, you will not propel forwards and hit the dashboard, and your knee will be spared even if everything else is going haywire because you're protected by the belt. You are kept behind and the dashboard is still far away from you even if you jerk yourself a little bit forward. Now, ninth, this is a little controversial, but I'll explain why. Do not spend longer than 15 minutes on a treadmill. Now, for the human body, a treadmill is a very hard surface and a very unnatural surface to walk on. However, if you have good shoes and if you have consciously been trying to walk properly, it is okay to use a treadmill for a small amount of time. Otherwise, if you notice, when you hit your foot on the treadmill, you can hear a thud. That thud is the force going upwards and straight up your knee. So, your walking pace and your walking speed changes when you're on the treadmill compared to when you're walking in an open ground or in a free area. Second, when you're on the treadmill, you often hold on to the bar. So your body leans forward. Now, again, when your body leans forward, your knees have to do more work. Your ankles also have to lean forward. your hip will also lean forward. So again, that is a discrepancy and your biomechanics are off the charts. So that's why I say you can use the treadmill, but 15 minutes or anything longer than that is not advisable personally by me. However, if you can maintain your footwear, if you can maintain your style of walking, if you can keep in mind that you don't touch the handlebar at all, you can use the treadmill. But you will notice a difference in your knees when you switch over from a treadmill to walking in a free ground or even on the road for that matter. 10th, walk barefoot for a few minutes daily. Now, when you walk barefoot for a few minutes daily, there are sensors on the base of your foot which send signals and pressure signals up your knee. Being in footwear all the time sort of numbs them down, and it is important to ground your feet on either a grass surface or even at home, but make sure you consciously walk barefoot for a few minutes every day. 11, never skip warm up and cool down. Extremely important. If you just get up on a treadmill or on a cycle or just start walking immediately out of your bed, you will end up with an injury. Warm up makes sure that there is an increased blood flow in all your joints. It's making sure that all your joints are lubricated before you start working on them or before you start putting pressure on them. And once you're done with your exercises, your heart rate is higher, there is an endorphin rush in your body is at a very high state, and that is not optimal for your day-to-day life, which is why cool down is extremely important after your exercise sessions to make sure your joints stay protected. Improve your balance. This again goes in terms with keeping your ankles healthy. When your ankles are healthy, your balance will not go for a toss, in turn keeping your knees healthy. Now, I understand that.
Thank you. क्या हाल क्या मेरे दोनों गुगु कहाँ हैं?
अनम्यूट कीजिए प्लीज अपने आप को.
Okay. So I understand that this whole seminar was about knee, but I spoke a lot about foot and footwear and ankle. मुझे यही message pass करना है कि your knee issues or your knee pain is never really because of your knee. It is because of how you keep your knees in regards to the rest of your body. Now, these are ideal postures for various activities. I want you to pay attention to the car in the left. Now, we have the habit of keeping this leg rested on the door like this outside, which is wrong. Your leg has to face forward in parallel with the knee, with the seat, and your ankle will go down and your heel will touch the ground and touch your accelerator brake, however it is. Your back will stay straight. Your elbows should be in line and at about a 40-degree angle from the seat, and the steering wheel should be close enough to you so that you don't have to extend your arms a lot. But please pay attention on how the knee is placed, because we all have the habit of resting the right knee on the door, which in turn affects your ankle and then your knee. Now, this is for everybody working at home. You can see that she's choosing to keep a stool. Now, this is very uncommon in our households. Everybody just works in the kitchen standing. Why would you do that? When you know that you're waiting for something to cook, or when you know that you can do something by sitting down, choose to take that time out and give rest to your knees. Don't unnecessarily put pressure on them just because you can. Right now, it is okay to do so, but in the long run, you will start seeing differences. And this is an ideal ergonomic workspace where you can see her ankle is well rested, her hip is in line with the seat, her back is supported, and she doesn't even have to bend her neck a lot while looking at the monitor. Now, what are maintenance exercises? For knees, I would suggest that these three are your best friends. Slow controlled movement will improve blood circulation in the knee. And when you improve the blood circulation in any joint, it will take away the toxins, the inflammatory products, the the hormones causing issues, and take them away from the joint. And remember, when you have knee issues, don't go for running, don't immediately go for javelin throw, don't go for high impact football exercises that are taxing on your body. Stick to low impact exercises which show you results, like swimming, where buoyancy takes care of your weight, cycling, where your knee is not being jerked a lot, your ankles and your hips are also being used, walking. Nothing is better than walking for knee patients. Now, this is what a knee replacement looks like, which is your last resort. If none of those things work for you, this could probably work for you. But even after getting a knee replacement, the success rate for knee replacements is about 10 years. So, one, after doing the surgery, you will have pain around the muscles if you have not trained your muscles before the surgery. So, you will still require physiotherapy pre-surgery and post-surgery. However, this does not guarantee that the pain will go away 100%. When should you seek professional help? This is just a rerun of what we already know. If there is no change in primary symptoms in 72 hours, which is your swelling, pain, if you keep icing it and if you don't see any change, you have to contact a doctor immediately. If you see that the swelling or the injury keeps increasing, the hemorrhage is growing, the swelling has increased, contact a doctor. If you see any signs of infection, which is like fever, malaise, if you feel the person is severely lethargic after the injury, you need to immediately speak to a doctor and not wait. Inability to move the joint. If the joint is fractured, the person will be in immense pain and will not be able to move it. You cannot do anything about this at home. Speak to a doctor. And unbearable pain not relieved by OTC medication. If you take your regular painkillers and if you don't see any difference in pain, it could be a major injury happening inside, which we cannot tell from outside. So you need to get it investigated ASAP and seek help. Now we are open for questions. If anybody, okay, we have a lot in the chat. You guys can. Does anyone have any questions? Please unmute, raise your hand, unmute yourself, and
I'll just see. Indu Jain might be asking. There is a question from Mrs. Indu Jain. Indu Jain, are you there?
Yeah, sir, I am here.
Please ask your question.
Ma'am, I just want to ask what's the difference between osteoporosis and osteoarthritis
okay,
and how can we manage?
of course. So osteoarthritis and osteoporosis are two different things. Osteoporosis is when the density of your bone is going down, when the cells in your bone are not being formed faster than they are being regenerated. And osteoarthritis is when your joints are degenerating because of aging, because of your predisposition, because of your activity. So osteoporosis is a condition that happens in all the bones everywhere because of something that is happening inside the bone. And osteoarthritis is a connective tissue disorder which can happen mostly in joints and more commonly seen in smaller joints like your hands and your knees. A knee is one of the major joints where you can see it, but very commonly you will see nodules forming in your fingers, between your knuckles. You will see pain here. You will have morning stiffness in osteoarthritis. It is the most prominent sign of having osteoarthritis.
Ma'am, one question more. Can osteoporosis also be managed with physiotherapy?
Absolutely. So research has shown that to increase the amount of bone formation inside your body, you have to put load on it. So every time you do weight training, every time you lift weights, you're actually not only treating the muscle which you're using, but also increasing the production of bone in your body. So don't shy away to go to the gym, pick up the weights, or if you can't even go to the gym, take a 1 liter bottle at home and start with your upper body. You don't have to, need the gym. You don't have to go outside to do this. But any amount of strength training, any amount of lifting at any age will progress your bone health like nothing else. Not even medication can match the amount of natural processes that go on when you load your body with appropriate weights.
Okay. Thank you, ma'am. Thank you very much.
I'll request all the participants to switch on their videos so that, especially if you are asking a question. If you are asking a question, please switch on your video. Mridul Jain, you have a question. Please ask your question.
First of all, I would like to congratulate Minal ma'am. It was a wonderful session and very informative. Some questions were there in the beginning, but by the end of it, I believe everything was resolved. So thank you. So thank you so much. And I would like, are you available for consultation? Because I have an osteoarthritic knee and maybe on the KL chart, it would be 3.
Okay.
So I am working on it, but my problem is that when I try to do, the day I do the exercises for weight training and the strengthening, my knee gets locked. Otherwise, the pain is bearable. I am not eating any NSAID for that. Of course, I'm taking collagen peptides and things like that, but my doctor says that he really can't say much towards the efficacy because collagen eaten originally orally may not, or hyaluronic acid also taken orally may not reflect actually in the knee.
Yeah.
So in the knee, what you need is a corticosteroid or a hyaluronic straight away injection. But they also you cannot take enough. So I think the only thing that should come to my rescue is the whatever you talked about. So I am already aware of it, trying to do that. Yes, I am class 1 obese as well. So
Please.
Trying to work on that also. But then number one, I would like to consult you.
Sure.
And where are you having your clinic for that matter?
Mumbai. We can talk on the group. My number is
We
there.
will talk on the group. Are you a part of our group?
Yes.
Please.
Okay, I will talk to you. Then I'll get your number also and I'll talk to you.
Mridul, please be brief. Please. Others
चावला
also
जी सॉरी
there.
सॉरी सर मेरे को सिर्फ यही पूछना है कि ये वेट ट्रेनिंग करने के बाद मेरे नीज ज्यादा लॉक्ड क्यों फील होते हैं?
There is a lot of reasons why that can happen. I don't know how much weight you lift. I don't know how you
1
lift.
kg. I think it is.
No, we will
2 kgs.
consult. Let's not discuss your private case publicly. We will consult one-on-one. What is the next question?
Annu ji, please ask your question. I'll request all of you to be brief and don't go for personal consultation here. They should be general and they should be, creating awareness amongst all the participants, please.
थैंक यू डॉक्टर, बहुत अच्छा आपका इंफॉर्मेशन था आज का। पर मुझे ये पूछना था कि ओनली स्टेयर्स चढ़ने में मेरे एक नी में पेन हो रहा है जो अभी स्टार्ट हुआ है कुछ ही दिनों से, तो क्या ये चल क्या है अभी स्टार्ट हुआ है कुछ ही दिनों से?
It is manageable. It is manageable, but we'll have to take proper history and everything.
अच्छा, okay.
Okay, we can get in touch later.
ठीक है.
Keshav ji, please. Next Keshav ji. Thank you, Anu ji.
Hello.
हाँ जी, yes.
Namaskar, Dr. Minal.
Hi.
So my question is one specific element, that is swell knee. What is your approach to cure a swell knee?
A swollen knee?
Swollen knee.
If you have had it for a small amount of time, it will be ice and elevating your knee. If you have had it for a long amount of time, we will have to do some blood investigation. We will have to get an X-ray and we will have to find the root cause of what is happening. We will have to check your footwear. We will have to check your daily routine and what are your activities. And then we can come to an answer of what are the available treatment options for you.
Okay. Thank you.
Neeraj ji, please ask your question.
नमस्कार डॉक्टर शाह, मेरा जो है एक क्वेश्चन है, ये लॉन्ग कोविड के बाद क्या नीज पे कोई बैड इफेक्ट होता है क्या? मुझे लेफ्ट साइड के जो नी है उसमें थोड़ी सी प्रॉब्लम मुझे लगती है, मुझे लॉन्ग कोविड हुआ था, तो मैं ये जानना चाहता हूँ ये क्या लॉन्ग कोविड का ही इफेक्ट है क्या?
लॉन्ग कोविड में आर्टिकुलर मतलब जॉइंट के मैनिफेस्टेशंस दिखे गए हैं इन्फ्लेमेटरी, but in your case, I don't know, were you an active person before who stopped doing his activity, or are you doing activity which is not appropriate? So lot of factors that could be causing pain in one knee and not in the other knee. So we'll have to check why only that knee and why not the other knee.
Anjali, Dr. Anjali, you please ask a question.
Hi.
Thank you, Dr. Meena. Lovely session. I just wanted to answer regarding the long COVID and a lot of knee pain, which I have been seeing also. I think a lot of rheumatoid arthritis and AN is coming positive, and people who had the COVID and is presenting as long COVID arthritis or autoimmune arthritis. So people have to be careful before they embark on very high intensity workout in the first 6 months of getting a COVID also. That's one advice I wanted to give. And also, like, we are seeing a lot of ACL ruptures also very commonly seen in long COVID cases. So that's your answer, I think. You've been seeing a lot.
Okay,
Thank you.
there is a question.
Thanks, Dr. Anjali.
Are there any specific brands of shoes that you recommend for better health, knee health?
Can I name those brands? I will give you a basic rundown. Any shoes that say that cushion, gel, air steppers, cloud, don't. You don't need the cushion, you don't need the gel. You've been walking like this for a very long time. But if you feel like you have a condition, you will have to opt for cushion, which is right for you. So for a general consensus, Clarks is a good brand. Asics is a good brand, and FitFlop, FITFLOP, is a great brand if you want good knees. Your basics, Nike, Reebok, are not going to cut it. As fancy as they look, as cool as they sound, as expensive as they sound, you're causing damage and your knees will have to pay for it. So that's that.
Thank you, Minal. Thank you for the nice
Thank you so
session.
much for having me today, sir.
Thank you. Thank you very much. You are always available. That's a great thing. Whenever we call you, whenever I contact you, your availability, you have always shown interest. And I request all of you to kindly participate. We'll have the next session on 2nd. That will be long COVID rehabilitation by Dr. Anjali herself. She's there with us. So do join, same time, same channel, every Wednesday at 2 o'clock. Dr. Kalra, would you like to say something, please?
No, it was a nice session. It was a nice session. Thank you.
Thank you all. See you next Wednesday, 2 o'clock. Same time, same channel. Bye.